We had real problems in Newham in the late 1990s. We had real problems with our service, which was enormously under stress. And we also knew that our patient outcomes were very poor. So we had all providers around the table. So we had the community dietitians, we had the hospital consultants, we had the local GPs, we had some patient representatives who were quite vocal. And it was a very creative process where we started redesigning the whole service.
When I moved to my new home and I went to GP to sign up, and as a process of sign up they gave me some blood test, urine test and other sort of tests, and after that when I see my GP and then he told me that I'm a diabetic, it was not big shock about my diabetic because I've got a family history, so I know a little bit about it. When I was working, I was feeling tired. I have to go to the loo every half an hour or 1 hour. Even after full 8 hours sleep, I was feeling that I've got lack of energy and still tired, lazy to go to work, something like this. Initially, I thought about myself only, so I was 50-50. And then later on, when I think about my family, every time I see my daughter's face, I thought, I can do anything to see that my daughters, they are going to uni or get married, and have a lovely family. And that's actually drive me to go for a better diabetic's life.
The two key things that patients can do to help their bodies respond to their own insulin, become more sensitive to their own insulin, is to be more active. Exercise really has a big impact on that.
I try to do some exercise, like activities a lot. For example, when I go to work, instead of taking bus, I walk about 15 minutes to go to station, and get off from the station to workplace another 15 minutes.
The other thing that patients can also do to help is to watch the amount of carbohydrate that they eat, because carbohydrate tends to stimulate insulin production, it tends to stress the system. When patients are on insulin, they always do need some carbohydrate with their food, but we do try to adjust it so it's a more moderate amount.
I have to cut the size of my breakfast, and in lunchtime a small portion of rice and lots of vegetables, and of course fruits every day, and then in dinner only salads and one pita bread, that's it. My wife helps me a lot, or sometimes even she pushed me to change. So she stopped my sugar and she started giving me the sweetener, and sometimes she don't give me the sweetener, I didn't even realize it. So I just continue for 5-6 months. I didn't know that she didn't put any candle or sweetener there, and then slowly I'm used to it now.
When we talk with patients, I always try and say, this is a partnership. I can't look after your diabetes on my own, and you can't look after your diabetes on your own, but together we can make some really good progress. They need to use us in primary care or the other diabetes services in the borough. They need to use us as a resource to help them manage themselves independently as best they can.